According to the Anxiety and Depression Association of America, more than 60 million people are diagnosed with depression in the United States, and more than 6 million people are diagnosed with anxiety. Today I'll be talking about 3 types of mental health therapy, how they differ and how they can benefit people in different mental health disorders. Personally, I have had many different kinds of mental health therapies through my life, and I've helped see that they have benefited me from one kind to another. There are many types of mental health therapies that people can benefit from, including cognitive behavioral therapy, interpersonal therapy, and psychodynamic therapy. The first kind of therapy I'll be talking about is cognitive behavioral therapy. According to Mayo Clinic, it was developed in the 1960s by Dr. Aaron T. Beck, and it focuses on negative behavior, and it's mostly a psychotherapy, which means talk therapy. It focuses on negative behavior and awareness of the negative behavior. So the therapist will ask if the patient has had any symptoms of mental illness, any negative thoughts or behavior in the past weeks, and they will go through a long period talking about how they can change the negative behavior into a positive behavior. This can help patients cope with stressful situations and prevent relapse with symptoms of mental illness. How it differs from interpersonal and psychodynamic therapy is that it's the most general of the therapies, and it helps a lot of people in a lot of different disorders, including anxiety, depression, mood disorders, sleep disorders, and OCD. And it focuses more on symptoms of mental illness rather than the whole illness itself. The second therapy is interpersonal therapy, according to John Markowitz and Myrna Weisman, both psychiatrists. It was developed in the late 1960s at Yale University. This therapy works on interpersonal problems and how to fix them in that patient's life. It happens in a span of 12 to 16 weeks, and it has 3 stages. The first stage is where the therapist will diagnose the patient with a mental illness, depression, or anxiety, and they will focus on a problem including divorce, a death in the family, a loss of a job, or a move to another country. The second stage is where the patient will use special strategies and specific problem-solving tactics in order to assert their needs into their own relationship problems and help mend those problems with their family. It differs from psychodynamic therapy and cognitive behavioral therapy because it focuses on a specific problem and the mental illness. And it's common for people who have multiple episodes of depression and panic attacks. The third therapy is psychodynamic therapy. According to John Shedler, a psychologist, it was developed in the late 1800s by Sigmund Freud, the father of psychology. Freud believed that many unconscious thoughts and behaviors that we thought of when we slept or dreamed had an effect on our conscious behaviors in our life. And that is basically what psychodynamic therapy is about. During the therapy sessions, the therapist will help the patient explore their full range of emotions, because with patients they might have a traumatic lifetime, including a traumatic childhood or abuse later on in life that hinders them from ranging a full range of emotions. And they'll also talk about how past events affect their current behavior and how their unconscious thoughts might portray what they want or need in the world. It differs from interpersonal therapy and cognitive behavioral therapy because it focuses on past behaviors and the unconscious behaviors while you're sleeping or dreaming. It's important to consider differences in these therapies when trying to choose one for yourself, because although they are all great at helping with mental health disorders, they all differ in what they really want to treat. Though they all help with mental health, they're different with their practices and methods and treatments. Thank you.